Hello friends, today we shall be studying about the fifth cranial nerve. The fifth cranial nerve is a mixed nerve. It has a sensory nucleus and a motor nucleus. The sensory nucleus is large. It is divided into three parts: the mesencephalic nucleus, the main sensory nucleus, and the spinal nucleus of the fifth cranial nerve. The mesencephalic nucleus is located in the midbrain and it is mainly responsible for proprioception. The main sensory nucleus, it is located in the pons and it is mainly responsible for touch and temperature. And the spinal nucleus of the fifth cranial nerve is located in the medulla and it is mainly responsible for pain. As we can see that the fifth cranial nerve is divided into three portions: the ophthalmic nerve, the maxillary nerve, and the mandibular nerve. Now we shall be studying about the areas that are being supplied by all the three divisions. The ophthalmic division mainly supplies the upper eyelid, the nose, the cornea, and the lacrimal gland. The maxillary division mainly supplies the lower eyelid, the upper teeth, palate, and the skin over the cheek. And the mandibular division mainly supplies the lower teeth, the skin over the chin, and the temporal region of the scalp. So now we'll be studying about the force of the fifth cranial nerve. As you've already studied that the fifth cranial nerve has a larger sensory root and a smaller motor root. The cell bodies of all the sensory neurons of the fifth cranial nerve are located inside the Gasserian ganglion, which is located inside the Meckel's cave. Now, from the Gasserian ganglion, it is divided into three divisions: the ophthalmic division, the maxillary division, and the mandibular division. The ophthalmic division travels through the lateral wall of the cavernous sinus and then divides into lacrimal nerve, frontal nerve, and nasociliary nerve, which then enter the superior orbital fissure and enter the orbit. The maxillary division enters the foramen rotundum and then it goes into the pterygopalatine fossa. Through the pterygopalatine fossa, it enters into the inferior orbital fissure, inferior orbital canal, and through the inferior orbital foramen, it enters the face and then divides into the nasal nerve, labial nerve, and the palpebral nerve. Now, the third division, that is the mandibular division of the Gasserian ganglion, along with the smaller motor root, they together form the mandibular trunk, and then they enter into the foramen ovale and divide into two divisions: the anterior division and the posterior division. The anterior division supplies three muscular branches to the temporalis, masseteric, and the pterygoid muscles, and one sensory to the buccal nerve. The posterior division has three branches: the auriculotemporal nerve, which is a sensory nerve; lingual nerve, that is also a sensory nerve; and the inferior alveolar nerve, that is a mixed nerve.
Welcome to the examination part of the fifth cranial nerve, that is the trigeminal nerve. Trigeminal nerve is a mixed nerve having the both sensory and the motor component. As we have talked earlier, trigeminal nerve has three branches: the ophthalmic, the maxillary, and the mandibular part. The sensory part is checked using a cotton, where touch sensation is checked and the patient is asked if he can feels the sensation of the cotton. ये कपास है, ये मैं आपको छूऊंगा और आप मेरे को बताना कि आपको स्पर्श आ रहा है कि नहीं. ठीक है, आंखें बंद करिए.
Got it. Got it. Got it. Got it. Got it. Got it.
This is how the sensory part is checked. The touch part of the trigeminal nerve. Pain sensation is checked by using the end of the pin, and the patient is asked if the patient can feel the pain sensation of the face. It is done bilateral. आंखें बंद करिए. समझ में आ रहा है?
Got it.
अच्छा.
Got it.
अच्छा.
Got it.
अच्छा.
Got it.
अभी.
Got it. Got it.
ठीक है. आंखें खोलो. This is how the pain sensation of the trigeminal nerve is checked: the ophthalmic, maxillary, and the mandibular division. Now we are checking the motor part of the trigeminal nerve. Patient is asked to clench the teeth and masseter muscle is checked while doing that. Let's go. Pterygoids are checked by asking the patient to open the mouth and putting some resistance while opening the mouth. The lateral pterygoids are checked by putting some pressure over the jaw while asking the patient to open the jaw. After doing the sensory and the motor examination, now we'll check the reflex of the trigeminal nerve. While seeing the corneal reflex, patient is asked to see outward and a cotton is touched over the cornea. While touching the cornea, the patient blinks the eye and a consensual reflex can be seen. Now we'll demonstrate the jaw jerk. One finger is put over the jaw, and we'll slowly strike over the finger. This is how a jaw jerk is demonstrated. Thank you.
Welcome to Clinical Snippets. Today we'll learn about facial nerve in details. We'll see this in three parts. First of all, the anatomy and the supply of it in short. Then secondly, mainly the important part is demonstration how to examine seventh cranial nerve, and thirdly, its clinical importance. So now to start with the first part, anatomy. Here facial nerve is seventh cranial nerve. It is mixed type of nerve. So it will have motor part, sensory part as well as the autonomic part. We have different nucleus for it. For the motor part, we have facial nucleus. For the sensory part, we have nucleus tractus solitarius, and for the autonomic part, we have superior salivatory and the lacrimal nucleus. Now, this all three combines and forms the intracranial part of the facial nerve. It originates, facial nerve originates from the pontomedullary junction. So here, it enters the petrous part of temporal bone, that is internal ear, through internal acoustic meatus. Now later it forms geniculate ganglion and the two genius. Genius is bend. Here is the first bend and then the second bend. And then it travels to the facial canal. Now here, while traveling the facial canal, it gives three branches. That is greater petrosal nerve, which will supply to lacrimal gland, which is used for the tear formation. Then second nerve is nerve to stapedius, which will supply to stapedius muscle. It is used mainly at the time of stapedius reflexes. And now the third is cauda tympanic nerve, which supplies the anterior two-third part of the tongue for taste sensation. It also supplies sublingual gland and also submandibular gland. Now this was the intracranial course. Now after traveling through the facial canal, it exits the temporal bone from stylomastoid foramen, and here the extracranial course of facial nerve starts. Now here, after entering exiting from stylomastoid foramen, here it gives three branches, three motor branches and 5 terminal branches. The three branches are posterior auricular nerve, which supplies occipitalis muscle, then stylohyoid, which supplies stylohyoid muscle, and the digastric nerve, which supplies posterior belly of digastric muscle. Then the facial nerve terminates by entering into the parotid gland and giving 5 terminal branches, which are temporal branch, zygomatic branch, buccal branch, mandibular branch, and cervical branch. Now these terminal branches supplies the facial muscles, which are the facial muscles are within 6, that is frontal belly of occipitofrontalis muscle, orbicularis oculi, orbicularis oris, corrugator supercilii, buccinator, and lastly platysma. So this was the basic of intracranial and extracranial course of facial nerve. Now coming to the second and the most important part, that is demonstration of how to examine seventh cranial nerve, that is facial nerve. मैं आपके चेहरे की जांच करने जा रही हूँ, क्या मैं कर सकती हूँ?
Yes.
अपने आप आईब्रोज ऊपर कर दीजिए. हाँ. Here the appearance of the folds are significant. Here we are examining frontal belly of occipitofrontalis muscle. अभी आप आईब्रोज को नजदीक लेकर आइए. Here this appearance of the folds are significant, and here we are examining corrugator supercilii muscle. अभी आप आपके आंखें क्लोज कर दीजिए. मैं खोलने की कोशिश करूंगी, आपको खोलने नहीं देना है. बंद कर दीजिए. So here we are examining orbicularis oculus muscle. अभी हम सीटी कैसे बजाते हैं वैसे आपका मुंह कर दीजिए. हाँ, तो here we are examining orbicularis oris muscle. अभी हम आपके दोनों भी गालों में हवा भर दीजिए. मैं दबाने की कोशिश करूँगी, आपको दबाने नहीं देना है. So here we are examining buccinator muscle. अभी आप ई करके आपके नेक के मसल्स को टाइट कर दीजिए. Yes. Here we are examining platysma muscle.
Now, coming to the clinical aspect of seventh cranial nerve, basically the face is divided into upper part and the lower part. Similarly, the nucleus in the pons are also divided into upper part and the lower part. The upper part is innervated by the ipsilateral side and the contralateral side, and the lower part is only innervated by the contralateral side. So, two types of lesions are there, upper motor neuron type and lower motor neuron type lesions. In the lower motor neuron type of lesion, there will be ipsilateral side of the weakness, while the lesion on the upper motor neuron type, there will be the paralysis of the lower part contralateral side.